Hi there guys, and welcome to Journey of a Student Nurse. My name is Lee. So in today's video I'm going to be doing something slightly different. I'm going to be talking about some of the nursing apps that you can get for your smartphone or your tablet device. So all these apps that I'm using today are available from the Google Play Store or the Apple App Store. I will also point out a couple of things that some of these apps are free. Also, some of them do have a bit of a subscription service. You do need to pay for them, and I'll point these out a wee bit later on. I will also say that a few of these apps are from NHS Scotland and have relevant information for students and staff who train and work within NHS Scotland. So some of the information may not be relevant to students or staff who are in other health boards like in Wales or trusts in England. So it's always worth checking up to see if you've got local apps that are relevant for the similar information. So that being said, why app learning? What's the benefit? Well, in my opinion, one of the benefits is it's quick to access and you don't need to go searching for through various internet pages to try and find the information. And it's good if you can get it out on your smartphone or your tablet and you can just go into the app and just access the relevant information. You may need to search through the app to find some of the information, but again, it's very quick and it's very easy to access. So I'm going to start off by talking about some of the apps that I have and why I think they are beneficial. And then I'm going to show you a few of the apps that I tend to use quite a lot for some of my learning. So the first app that I'm going to talk about is the BNF app, or the British National Formulary. Now the British National Formulary is the main drugs book that we have here in the UK, and it's got a list of all the medications that we can use that we can give to patients. Again, it's always important to check with local formularies to see what drugs can be prescribed and administered within your relevant area. I find the BNF app much more user friendly than actually the paperback version of the BNF, and it's easier to find the drug that you're looking for, and you're not having to search through pages and pages or go through the index. As for example, if I wanted to go find a drug such as paracetamol, I can search for P, I'll go into P and I will scroll down until I find paracetamol. And then I can go into that area and then I can find all the relevant information about paracetamol and what I need for that. Again, the BNF app isn't limited just to that. I can access other areas as well, such as nurse prescribers formulary, and I can also go into the children's BNF as well. But also, as a student nurse, one of the things that I do need to know as well is wound care as well, and I can go into the BNF wound care section and look up wound care dressings and what they're about. Again, also using my local wound care formulary as well, and the list of approved medicaments and bandages, etc. that I can use within my health board. So working within that local policy. The next app that I'm going to talk about is one that I think is really important, and that's the app that's next to it, and that's my calculator. Now, why have I moved my calculator here? Well, as nurses, we do need to be able to do drugs calculations, and we should be able just to do them in our head as well, and be able to do them that way. However, it's always useful to have the calculator as well, just to double check that you've done the calculation right. For example, if you were calculating IV medication that needed to be administered, it's very useful for that reason as well. So I've also got a nursing calculator app as well. Again, I don't heavily rely on this one as much, as I do feel that it may not be as accurate as my calculator may be, but again, it is useful, and it's a good useful training tool, as it does help with your conversions as well, from like milligrams to micrograms, or micrograms up to milligrams. So it's always useful to know what you're doing. Again, it's a wee useful app, I find. Another app that I find I enjoy quite a lot looking at is the NHS Education for Scotland National Early Warning Score and the sepsis screening app. This is a really useful app, and it's intended to help both students and staff to be able to calculate if a patient is at risk of having a septic attack, and it is useful. Again, I will point out that you should never rely solely on the app. Clinical judgment is very important, but it is a useful tool to help, especially when you're learning, I think, to understand why, or how a person might be having how to determine whether someone's having a septic attack. So it can be useful. It's one that I enjoy using, and I make up scenarios in my head, and I will, put various numbers in and help myself learn how to understand if a person's having a septic attack. Another app that I'm very fond of is Geeky Medics, and this is me giving them a bit of praise for what they do. So this Geeky Medics is a UK-based company, and it is primarily aimed at medical students who undertake clinical OSCEs and these various clinical tests that they do. However, in nursing now, we are starting to do more and more OSCEs in our both pre-reg and some post-registration training, and it's going to become more and more relevant. However, a lot of the information that you can get from this app is very much crosses into nursing. And when I had my previous phone, I had downloaded the app and I had a subscription to it. I'm still to get a subscription for this, so this is what a non-subscribing service, when you've not subscribed, looks like. And they only give you limited access to one or two areas within the app. So I'm going to go into cardiovascular and give an example of one that is very useful, and one that all things that nurses should be able to do is blood pressure measurement. And this is a great wee app, as it tells you how you would do blood pressure within an OSCE scenario, and more so how to undertake a blood pressure as well. And the information is presented in a way that isn't too heavy, it's understandable, and it's almost intended to do it in a way that you can almost act out. For example, explaining the procedure. I will be measuring your blood pressure. This will involve inflating a cuff around your arm briefly and listening to the pulse with a stethoscope. And it's a great wee way of just helping to explain, to your patients how you will undertake the procedure and what the procedure involves. So, and it's good because I've found it really beneficial. There are far more things within the app that have just come out recently, and it is a very, very useful thing to do, and I actually think these guys have done an amazing job. However, Geeky Medics do have a website as well where you can access all the same information and more information as well, and it is worth it. I will point out that the subscription service at the moment for each year is sitting at $6.99 at the moment, and this is in the month of February of 2019. So this is just a wee point out that the price may change in the future. I don't know whether it's due to go up or not, but that's what it is currently, and I can't highly recommend this app enough. I mean, as much to say I've used the website in the past and been able to access the same information and be able to print it off, it's very much different having access on your phone, as it's good you can just go into the app and then you can just get what you need there and then. And I think these guys have done an amazing job with what they have, and they're always updating their procedure, and they've got YouTube videos as well that go through the scenarios as well. I'm going to quickly talk about a couple more apps that I think have been very useful, and the next one is the Canvas student app. So the university that I'm at use the Canvas software, and that's where all our lecture slides and our lecture capture things go up. And we can access our information that we've been taught, and assignment results as well. I won't go into that as it is got some information that I'm not really going to want to talk about, as it's university information in there as well. However, I think it's a really useful app. I find it beneficial, and depending on the university that you're at, They will probably use different software. It is worth looking to see if they have an app that you can download onto your phone, so you can then access your lecture slides on the go. And again, I've been on placement when I've gone into the app and I've looked through to find my lecture slides and been able to look at the information and be able to apply that information immediately into practice. So the last app that I'm going to quickly talk about is the Lippmann app. Now, I will say this is a subscription as well. It's a slightly different subscription where that I don't know if you have to pay a certain amount each year or not for it, but when I bought my Lippmann stethoscope a few months ago, I got access to the Learning app for free because I purchased the Lippmann stethoscope, obviously, and I found this app really beneficial. And one of the things in particular I found is being able to learn the basics of auscultation and actually be able to listen to heart sounds as well. And I think that's been really useful. So, and it tells you what what a normal heart should sound like, and what a murmur of atrial septal defect might sound like, and various other heart sounds as well as lung sounds as well. And as coming to the end of this video, I'm going to quickly finish up and talk about one final app that I found really beneficial, and that's talking about ECGs. Again, I would take this information quite lightly, as I don't know if it is an American-based app or not, or if it's a UK app. So again, I'm being careful how to use the information. But again, an ECG is similar to what you'll do no matter what, whether that's a 3-lead or a 12-lead ECG. And it tells you how to go through and carry out the procedure. I found it really useful. ECGs are one of the things that I do get really confused by, so it's useful to have an app for that. So I'm just going to finish and say thank you for watching this video. It means a lot, and I hope that you have enjoyed the content. Please comment below if you have enjoyed it, and I'm always open for feedback of how I can improve my videos for the future. And please leave feedback as well of what you would like to see in the future on this channel, as that very much helps me to be able to produce the content, to know what you guys like out there. I also want to finish off and say, please give a like to this video, as it really does help the channel as well. And also, please subscribe to Journey of a Student Nurse as well. And I really hope that you have enjoyed it, and I hope that you've enjoyed this first video of 2019. And I do want to apologise for the lack of videos over the last month. I've just been really busy with assignments, as well as dealing a lot of stuff in my personal life as well, which has meant I've not been able to make these videos. So again, thank you for watching the video, and I wish you all the best over the next wee while, and I will see you in the next video.